would be much better be able to approximate the patient's feeling and kind of reflect it back to them, more approximate to in a way that they can understand it, etc. So if you translate that into a concrete therapeutic skill, it would be, yeah, that's exactly what you, absolutely right, yes. Yes?
I have a question about how to introduce such concepts clinically, like to our clients that are struggling with anxiety, that don't want to use like medication, that want to, are interested in mindfulness, or you think they would be interested, like how to start that conversation? Right.
That's a good question, because very anxious people get more anxious if you introduce mindfulness as a procedure or a meditative technique, and you tell them, okay, close your eyes and I'm going to teach you, you have to sit every day 15 minutes. Generally doesn't work that way. So we would recommend that you use what we call it as a process-oriented form of mindfulness, where you use principles of CBT or psychodynamics to address mindfulness issues, starting from basic things like, when you are speaking, it seems like you are not aware of your breathing and the movement of your abdomen. And I think that's probably how, when you are speaking under anxiety, that must be how you are doing that's how you probably are, unaware of yourself, specifically your breathing and your abdominal movements and your body. You're not aware of it. You just, that's one way to start introducing the concept of, are they aware of their body when they are under stress? Absolutely not. Most people, when they are stressed, particularly interpersonal situation, are not, because they are worrying about, if I say this, maybe the person will get upset, or does she like me? Will I say something wrong? That the person will never want to talk to me again, things like that, right? We're more preoccupied by such concerns. So, of course, as I mentioned, attention is limited resource. So if you're attending so narrowly in that way, there's no attention that can be available to be aware of it. Mindfulness this is a good example. Mindfulness in the long run can teach such patients to be aware of their thoughts, that, oh, will this person like me? And at the same time be aware that they're breathing shallow, or their jaws are clenched, or they are sweating, etc. Yes?
Two questions. One is, are you thinking the delivery method of it being similar to mindfulness-based stress reduction as far as like a certain number of weeks with any person, or how are you developing how you want to,
Yeah, right. The 8-week is like this researched kind of thing, where you have 8 weeks. If you say, I have an 8-week protocol, then they'll look at your application. And if you say, like, I have 16 weeks or 12 weeks, like, oh, gee, that sounds a bit too long. And and the insurance thing and all of that. But so in that context, we kind of try to confine it to 8 weeks. And also, because classical mindfulness is much more demanding, we developed that's what we are studying, is online computerized training in just sustained attention and distributed attention to threatening faces or threatening scenes, to complement the mindfulness practice, so that they maximize the practice within 8 weeks, which is rather short for something quite demanding. But we feel like if online training through like 10 minutes of computerized training in the morning, and 15 minutes of mindfulness training in the evening kind of would use different parts of the brain. One would be perceptual, computerized is purely perceptual training. Mindfulness is purely cognitive training. And if you take attention, external attention, which is associated with perception, and internal attention, which is associated with cognition. If you study these two types of attention, there's a lot of emerging evidence, still not known because it's not studied much, that networks and the two have very independent capabilities. Until now, it was thought like internal, external attention, both are pretty much the same. That's not true at all. They're very different. You know, like someone like a basketball player or a golfer, they can have excellent external attention. They can attend to the ball. But if you ask them, okay, now let's see if you can demonstrate that attention to internal objects like your thoughts, they would not be able to do that. They wouldn't necessarily have the capacity to do that. Okay, so these are very different processes. Yes.
I would say the significant difference between classical mindfulness and the type of mindfulness that's currently being used between therapists and the clients.
Right.
Which I probably identified maybe mindfulness-based stress reduction.
That's right.
Is it the principal difference? Is it the attention in classical mindfulness on the reflexive abdominal breathing? I guess I'm struggling to understand the big difference between the two.
Yeah, the main difference is in like MBSR, it's sustained switching attention. You're constantly switching. In MBSR, they allow you to focus on the breath. If a thought comes, invite the thought.
Okay.
If a feeling comes, go to that, come back to the breath. They allow you that, what we call switching attention. And they develop sustained attention. In classical mindfulness, switching attention is not recommended. You stick to one object, and if a thought comes, you try to push it away and come back to that. It's a different strategy.
And when you say pushing away, we may use, I guess maybe just being aware of it without actually indulging in it.
Pushing away literally means like you are aware. As soon as you are aware of the distraction, you note it and then push it away. Yeah. It's not like you are not going to be curious about the distraction. You're not going to figure out what does this represent, or you're not going to kind of interact with it and say, oh, this is just a thought. Thoughts are not facts. Thoughts are just thoughts. You wouldn't say that.
Is anyone reporting like additional anxiety by pushing the thought away? Like, when a thought comes up and the actual effort.
Initially, there will be more anxiety. Yes, absolutely. There will be very logical to expect initial anxiety, but when you're treating a anxious patient, remember you need to first mobilize anxiety under controlled conditions, like in exposure therapy. The whole goal is to increase the anxiety, because the whole premise is that anxiety can only go up to certain, biologically, it can go only to a certain maximum. After that, it will just begin to come down. But of course, most anxious people will not test themselves to see how far it can go. They at once react at the slightest discomfort. And that's the problem. If you react at the slightest discomfort, you just reinforce your fear of any kind of distress. Like you hear a sound or someone says something negative. Even though it's not related to you, you become hypersensitive to anything negative. Why? Because you're constantly avoiding any unpleasant situation that you personally experience, and not allowing yourself to like push your limits to test out how far you can tolerate it. Exposure is based on that principle, and it's the only thing that really works in, you know, really works from a research perspective, because, yeah. Okay, yes, please.
When I've been teaching mindfulness to my clients, I haven't been saying the words push the thought away. What I've been saying, and I want to check this with you, is when I become aware that I'm thinking, I say thinking, label it, and then return to focus on the breathing.
Right.
Is that the same thing?
That's the same thing. You know,
Okay.
as I was mentioning, you become aware of it, you can use the label. Minimum label is you use a predicate, never a noun. You know, you shouldn't, or an adjective saying, oh, it's a horrible thought, or it's a horrible feeling. Because if you use the word horrible, it will trigger associative images and so forth. So you'll be locked into it. So thinking is a predicate that tells you what you are doing in the moment. You are thinking, so it's distancing yourself from the content of the thought, which is less likely to pull you back. And the thing is, the therapist shouldn't reveal the purpose to the patient. The test is to see if the patient discover that. At least, you know, like OCD patients who are very obsessive about the practice, they discover that much faster than others. They say, oh, gee, you know, because they're very obsessive in what they do. So,
can you please repeat what it is that the client or patient should discover? Can you please repeat what it is that the person should discover?
Oh, I was just saying that it's the, you shouldn't reveal to the patient the purpose of the labeling.
Okay.
Yeah, you want them to discover it experientially. That's one thing about mindfulness. You want to just give them the technique. Never tell them, oh, this should happen, or if you do this, this will happen. The whole idea of mindfulness is it has to be experiential. In the past, unfortunately we've lost this tradition in the Buddhist culture. You know, a teacher will give you a practice, then you got to go on out into your, you know, in your cell or in your cave or wherever you live, and practice. And then the whole idea is, of course, self-discovery. That was how it was supposed to be taught. Then you had to come back after 2 weeks, 3 weeks, and report. And that another benefit of that kind of setup is the teacher can figure out, you know, right away how well you are doing. But if the teacher says, oh, you do this, this will happen, so look for this, or write down this, or write down that, it's very hard to assess how much you are improving or not. Because what you are going to report is what the teacher told you to expect. You are going to report that. So it becomes very confounding. Yes?
So maybe we'll take a last question.
Okay.
You explained the difference between classical mindfulness and MBSR really clearly to me. What I was wondering is, does MBSR represent a different Buddhist tradition, or was that just a kind of an American adaptation?
Well, Kabat-Zinn says he took the inspiration from the Buddhist tradition. I think I believe he studied with a East Asian teacher. So there may be some Zen influence, I'm not sure. But he says MBSR is not a Buddhist practice. And virtually all Buddhist practitioners will say MBSR is not a Buddhist practice. Yeah. But it's inspired by, yeah. And Kabat-Zinn says that.
So we'll have to leave it here. So just maybe we can express our appreciation to Dr.Rapgay. It's really refreshing to have somebody in the field who's so deeply immersed in both the theoretical presentation but also the experiential aspect. So you bring them together so beautifully. So thank you for coming.
Thank you so much. Yeah.
And we have a few minutes to actually hang out, have some food. Dr. Rapgay will be around for a few minutes before he goes back to his cell.
That was the wrong choice.